Afshi Vimal, and this is Health Matters by Malaysia Healthcare. Today I'm here with Dr. Ruslan and Guna to talk all about orthopedic health. So I think one thing we're always told since we're young is that drink milk so you have healthy bones. Is that true?
Well,
this is just
I call it it's just a commercial. All right. So I never had that kind of nutrition when I was kids. Yeah. So what you can see now in the supermarket, there is a high cal milk or whatever with calciums.
Yeah.
Yeah. So, but we live in a tropical country where a lot of suns. Yeah. So suns, and then our food. Yeah. Nasi lemak, all those things. A lot of calcium. Seafood, a lot of calciums. Yeah. So without suns, your calcium you can absorb into the body. So you need the sun, which is produce vitamin D.
Yeah.
So this is where sometimes you see that some of the commercial, they say that add vitamin D.
Vitamin D.
Vitamin D. Yeah. So but vitamin D is just not, you can get it from the sun.
Yeah.
Yeah. So when you're exposed to the suns, I think you will be healthy.
Yeah.
Yeah, for that. So,
we're lucky to
but
live in
I will
Malaysia.
Not comment on the
milk. But would you also say that those milks that are specifically targeted for older women for osteoporosis, are those even worth it as an option? Or can we not say that?
I think there is few brands.
We won't talk about the brands.
Yeah, just few brands, in the market, which is, I said, this good for. I still remember one of the actors those days. Actors say, "Eat and drink this milk. Will make your bones stronger for older women." Yeah, but I think it's still the same. What I believe is what I say just now. The strength come from the exercises.
Yeah,
and make sure you don't have any diseases that cause bone weakness. Do not injure your bones. And that's it. I think we'll be okay.
What are some ways we can generally maintain our bone health?
Want to start first?
Doctor first.
All right. So I think the best thing to maintain our bone health is usually you start from the young age. Yeah, usually is as young as even as primary school or even secondary school.
Yeah.
Because the person who are very active during that age, there is where the age is bone is growing at that age, and as your age growing in teenage, and it become bigger and stronger, and you need a lot of nourishments, nutritions, and calciums for bone growing. Yeah. So that's the best thing to do. And the bone stop growing at the age of 20. 19 to 20, yeah. So that means until then the bones keep growing.
Yeah.
So from 20 onwards is basically to maintain your bone strength, and that is where it start to have some good nourishment, exercises, and make sure that you don't have any diseases or accidents or sprains. Yeah. So once you have accidents or fall, for example, and you broke one of your bone because of the high velocities fall or accidents, it broke and then become malunited or become deformed. That is when you start to have bone problems. Yeah.
I see. What about you, Guna? What did you say for maintaining the health of our bone?
As doctor said, the whatever supplements, calcium, your food will be taken care by the doctors. So our part's basically more of exercises. So at certain age you need to strengthen your muscles. Yeah. So by strengthening the muscles, your bone also gets stronger.
Okay.
And so at the age of, doctor said, at the age of 20, your bones stop growing, right?
So after 20,
you have to maintain them, make it stronger. Regular exercises, for example, like strengthening. Carrying heavy dumbbells or TheraBands and all those stuff. And even, walking, jumping, like weight-bearing activities is important.
Okay.
Yeah. And then the other important part is for women.
Okay.
It's slightly different.
Oh, really?
Yeah. Because the bone, you have to maintain a bone until your age is about 45. Yeah, when you start having premenopausal periods. So because once you have a strong bone, yeah, after 45 or 50 years old, your femur bone usually becomes softer.
Oh,
It is called osteoporosis.
Yep.
So you cannot avoid it.
You can't avoid it.
Can't avoid it.
Okay.
So because once you menopause, definitely your bone become weaker. So before you become weaker, then usually the best thing to do is you keep your bone stronger.
As strong as possible, yeah.
Yeah, so by doing the exercises, and make sure that you have a very strong bone, good health, and then good nutrition until you age 45.
Okay.
So that's something like when you have to keep your money in the bank enough until 45
yes.
so that you can use
so
it
you can retire,
after that.
Same for the bones.
Yeah.
Same for the bone.
So what is actually the difference between like women's bodies and men's bodies when it comes to bones and bone health?
Well, I always call it this way. So women usually will have osteoporosis around that period, 50 years old. But for men, they do have osteoporosis as well, and usually at 65.
Oh, much later.
Much later. So the bone is become actually for men at the age of 60, actually much stronger than female. So this is why when above between 50 to 60s, there's a lot of women who have some bone problems and joint problem compared to men.
Okay.
But after 65 onwards,
everybody has problems.
Have this thing.
That's so interesting. I did not realize there was like such a big difference between men and women.
Yeah.
So, I mean, of course, as we've said, as you get older, the strength of your bone diminishes, and that can really impact your life. Some simple things like picking something off the ground or walking up and down the stairs, it really changes your life. And arthritis and osteoporosis, those are the two most common bone-related illnesses. So, what is arthritis and osteoporosis? Like specifically, what happens to your bones if you get those illnesses?
All right, osteoporosis is the name mentioned. Yeah, osteo meaning bone.
Okay.
Porous means porous, become porous.
Oh.
Yeah, so it's osteoporosis. So the bone become porous.
Okay.
So this is where when that particular age, young age, there is two cells in our bodies, in our bone. You could call osteoblast, which is forming the bone, osteoclast, which is diminish the bones. So in younger age, osteoblast is become more. Yeah, so that means you have more bone growing. So as between 20 to 50, it's more or less balanced. So when you become more than 50, the diminished bone or the osteoclast is more than the forming bone. So this is why it become osteoporosis. Okay. And for women, it depends on the estrogen, which is the female hormone. Yeah, which is you only happen in female. Once you diminish that, then the osteoporosis become more. This is what happened to do.
Okay. Right. And what about arthritis?
Arthritis is different than the knee. So arthritis basically, arthra is meaning is joint. IS is meaning inflammations.
Ah, okay.
So that means it's an inflammation of the joints.
Okay.
So the joint consists of a capsules. Yeah, it's a capsules which is surrounded by the membrane. So that particular membrane become inflamed, and there is so many reasons for arthritis.
So interesting. So how what are some of the reasons that we could get arthritis?
The most common one is either you can divide into two, which is sometimes due to traumatic, meaning it's to fall, accidents, sprain, injury when you're young. And like I told you before, the joint become deformed, and then imbalanced and causing some inflammations. The other one is basically because of the food. Yeah. For example, have you heard about gout?
Yeah.
Yeah, it's because of the uric acid, but not everybody have that. Yeah, it turns depend on certain familial
that's
disease, genetics. Yeah.
So can you actually get osteoporosis if you're younger than 45? Is there anything that like in lifestyle that can contribute to that?
No.
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 Okay lah, that's good to know.
No.
I don't have to worry about that for a few years.
No osteoporosis. Osteoporosis definitely depend on your female hormones.
Ah, okay.
Yeah.
So it's like out of the control of
correct,
lifestyle.
yeah. So as far as I know, we don't have any diseases that cause osteoporosis early age.
Thank God for that lah.
Correct, yeah.
But what can we do to prevent arthritis, for example?
Basically, it's just a good health of your joints. This is where, again, we emphasize about activities, physical activities from the younger age. So as the joint, you have some fluid inside it.
Okay.
So it's lubricants, act as a lubricant. So it will nourish the joints. So once you have a balanced nourishment of the joints, then your joints become healthy.
Okay.
That will prevent that. So the best thing to do, nourishment or to produce that fluid is by activities.
And what sort of activities are those?
More of like, as I mentioned for osteoporosis, it's going to be the same, like more of strengthening.
Strengthening.
Right? And it's basically like wear and tear. Right?
Okay.
So arthritis is more of like wear and tear, like overuse. We send our cars for maintenance to service, right? So it's the same way. Our physical activity has to be like, not a sedentary lifestyle without doing anything, just walking. For people are thinking walking, it's good. But, it's more of wear and tear as well. So you have to strengthen your muscles.
Yep.
By strengthening the muscles, your joint also gets strengthened. Your bone also gets strengthened. As doctor mentioned, the fluid will be produced more.
Is there such thing as like over exercising?
It is. Yeah. Like that's why arthritis, as doctor mentioned, can be early age with that's the athletes.
Yeah.
With the injuries, prone to injuries like recurrent injuries, they tend to get arthritis very often. Very early age.
Yeah.
So that is kind of overdoing.
Oh yeah,
right?
it is overdoing it for sure. So another illness that can significantly impact people is scoliosis. And I read that it was between 600,000 to 900,000 people that are affected by scoliosis.
Yeah.
And they're mostly between the ages of 10 to 17, which of course is such a tough time. You're a teenager, you've got all the hormones happening, you've got your friends, everything. It's obviously such a tough thing to deal with. And the surgery is also extremely invasive, at least as far as I know, because I had a friend in high school and she had like the bolts like in her spine, and it was such a big operation. So do we always need to do surgery if we are impacted by scoliosis?
Not necessary.
Not necessarily.
Yes. So scoliosis can be caused by a few problems. Yeah. For example, the congenital, meaning it's from birth. Maybe some of the spine's defect. That one you need to have some surgery to correct that.
Yeah.
But the common one that you see in the school or even maybe your friend is due to the familials or congenitals, and that the spine look like an S. This is why it is called scoliosis. Yeah. So there's some degrees that we measured during scoliosis, and usually if it is anything less than 15 to 25, we call it very mild, and then you don't need to do any surgery. So you have to do what you do, because patient will appear to you in your clinic at the age of just now, teenage, high school. And then we can just give what you call it exercises. One, the other one is we call it orthotic or jacket, to straighten the scoliosis.
Wow.
Yeah, but you need to use that jacket for 23 hours a day.
Oh my gosh! And at that age, is it fashionable?
Yes, that is the issues.
Yeah.
I have one of my patients that kind of thing, because she doesn't need surgery. She's not so bad, So I put her on the jacket. All right. I said you have to wear it for 23 hours a day.
For how long?
until the bone stop growing.
And usually that's about 1 year. 6 months?
No. It will
Up to
take
age
a
of
few years.
Few years.
Oh my god.
Few years. When you diagnose her at the age of 13, you just imagine until 19.
Oh my gosh. Yeah.
So that is the schooling period,
yeah.
you know, all right? So, the school, then you have to use that and then wear the uniform. And it is very obvious that she wears something inside. Yeah, so some of the friends will just say, tuck, just play around with that thing.
Yeah.
So the issue is not that one.
Yeah.
The inferiority complex among the colleagues. Yeah, they feel that I'm not normal.
It's embarrassing. Yeah.
So I have that kind of patients.
Yeah.
So until they went to university, I saw her again. Only then they changed, because after that I removed
Can remove the
jackets. Yeah.
Wow.
Some I can accept it. And then later on, 20 plus, got married. Yeah, children.
Didn't hinder her life, you know?
No. In fact, when she had one kid, they said, how come there's a lump here? All right, I examined her, then I think you are too thin. You put your weight about another 5 kg, 5 or 6 kg. So put weight so that hump will not so obvious to be seen.
Wow.
So now she got 3 kids.
Amazing.
Yeah, I still follow up.
What are some non-surgical options if you have scoliosis? Maybe Guna, do you have
as
anything to
Doctor
add?
mentioned earlier, brace. The first thing, right? They provide brace. Second thing is physiotherapy, obviously. By doing exercises, stretchings, and it has to be a regular. When the curve is like S curve, right? So one side gets shorter and one side gets lengthened.
Okay,
right? This side will be like curve like this, and this side muscles get shorter. So you have to stretch the shorter muscles, and we have to strengthen both sides. Then only, like, even though we can't completely make it straight, even though it's like slight changes will make a difference for them, and with the strengthening and stretchings, that gives a better relief for them. There are a lot of exercises to do, like posture correction exercises, right?
And can it help actually like straighten the spine?
Not completely, but
somewhat, or just to maintain?
Just to maintain, and slight changes you can see that.
Okay.
Yeah, there's a slight changes you can see.
And how often would someone have to go for physiotherapy?
We would advise them to come 5 days a week at least.
Wow.
Yeah, because you can teach them whatever exercise you want. I mean, like, it depends on the individual whether they will do it, and most of the time they don't do it, right? And it's quite tricky as well, all the exercises. You need somebody to help them, to guide them. So we would prefer them to come every day, right? 5 days a week, or at least 3 times a week, alternate days,
As much as they can commit.
Because it's at the young age, it's growing bone, like muscles are softer, much softer. So it's easy for us to treat them.
So how does bone density affect us all? Is that osteoporosis, the direct link?
Yes, it
That's
is.
what it is.
Because we measured osteoporosis by measuring the bone density.
I see.
Yeah, bone mineral density. We call it BMD.
So, so our bone densities tests, like, they are very accurate, like in measuring how strong we are.
Correct.
And how often do we need to do them?
At your age, no need. Okay. So once you
can save some money there.
Save a bit of money.
So your period is off.
Yeah.
After 5 years, then you start
Okay.
measuring that one as the preliminary guidelines, and then every 3 years you should do it until then.
All right.
And you can see the difference.
You'll see it slowly over time. So apart from the diseases that our bones can get, there's of course simple injuries, right? If you're playing sports, or if you're like me, very clumsy, fall down all the time, then you can really hurt your bones.
That's probably your heels.
Okay, I wanted to ask that as well, maybe a little later.
Yes, I have a question for doctor. Does any medicine can cause the osteoporosis, like medicine for diabetic hypertension, does that part of, can be a cause for osteoporosis?
No, that the medicine alone for some of the diseases can cause that. Usually it's not.
Right.
It's not a common side effect.
The medicines or treatment for cancers.
Right.
So that one is very toxic drug.
Yeah.
that one may cause. But the normal one, the normal for hypertension,
All
diabetic,
the pills.
the normal one is
Doesn't
not,
cause.
doesn't cause.
Right.
Like you said, the toxin.
So, I mean, if you're an athlete and you hurt yourself, it's so debilitating. Like, I used to dance. I remember if we twist an ankle, that's it. You know, you're so upset. You know, you can't play your sport again. And I mean, if you have a good healthcare system, if you have good medical professionals, you can definitely make a recovery. But I think there's a narrative that a lot of people have, that even I believed for a long time, that if I were to break my ankle or if I was to hurt a part of my body that I needed for my sport, I'm never going to regain how it was prior to it. Do you think that's true?
Want to start there?
What do you think?
No, not totally. This is not right. Because, like, there's always a...
That's always what people say, right?
Yeah, no. You have a time period where you take rest, right? Like, you wait for the recovery to happen. Then, again, every time you will hear the same thing, exercise and exercise and exercise, physical activities every time, right? So you have to rehabilitate again. So, for example, if you injure just the ligament torn, and it depends on the category as well, like stages, whether it's totally, torn or just partial torn. If total tear, like, you have to go for a surgery. Then what is next? Again, exercises, rehabilitations, right? So with the proper rehabilitations, you can go back to...
you can get back to 100%.
Yes. You can get back to your whatever, sports you've been doing, or even dancing.
Yeah.
I always give examples, two examples. One is the Ronaldo, not the current Ronaldo, the Brazilian Ronaldo. He had an ACL injury, which is the ligament injury. All right, so it was repaired, surgery done. Then you need to rest about 1 year to regain the activity to that level, as a professional level. But it said is started earlier, 8 months, and return the injury, and then that time redo the ligament, and then you had to wait for about 2 years, to regain that. So at 2 years, and then he played again, and usually it will not to that level that he had before, So somehow or other the coach doesn't. Coach usually you can see them very clearly. This is not very active as 2 years ago, and then he injured the other one. All right, so now totally gone. So the other example is Tiger Woods. The golfer.
Yeah.
He has a backache because of the swing. Because his swing is the one that make the ball hit very far. The way he hit the ball, then he injured the back. He got a disc, was repaired, injured again, was repaired, injured again, and this time they fused the hip. And 2 years later, he won the game again in major. So that means you can't really actually...
Yeah, you can make a full recovery and continue being an excellent athlete.
Yeah.
You just follow the protocol.
Yes, I was just about to say, what do I need to make that full recovery? Do you think it's that a lot of people struggle to rest for 1 year? Like that, I think especially if you're an athlete, like 1 year is, your career is only so long, and 1 year is a big...
Correct. So just, I think you're right. You need to have the protocol. You need to have this that I mentioned just now. You have to wait for one year. But if you start it earlier, then it's gone. It resides. So I have one of our national hockey player is under 20. He's injured his ligament. So I said, I need to repair your ligament. So doctor, can he play for the next game, international game in Spain? So I said, cannot. I said, why? This is his last year because he's 19. So because when you wait another year, it's become 20 over. So it's not eligible for that particular class. Right? So if you more than 20, you have to compete with the other seniors, which is maybe is not so
tougher or just different.
Just different. So I said, cannot. You can't. So when I did that, few months later, I think he went again against my advice.
He went again. Mhm.
Yeah, so injured. So I told the father, say, I told you so.
I mean, what is there to say,
Yeah,
right?
correct. Yeah. So that is you need to have some protocol.
Yeah.
Or
I think that concept comes down to everything in health,
yeah,
right?
yes, correct.
Yes.
Yeah,
Yeah, so everybody kind of struggles to maintain.
correct.
So when somebody hurts hurts a part of their body, hurts their bone, all of that, and it's just say it's not broken. How do we know, like, when do we do surgery? When do we do physiotherapy? Like, how do we make a decision on what's the best option if both options are available to us?
Usually there's whatever injuries, there's always grade 1, grade 2, grade 3. I mean, basically, they're graded. Yeah, even the injury for shoulders, they're grading. Fracture, so they grade it. Yeah, so whatever ligament also 1, 2, 3. Yeah, so anything the early stage, usually you don't need to do any surgery. So you just go to him,
We go to Guna.
go do the physiotherapy, and then get the muscle strengthening, and then wait until it heals. Yeah, then you go back to your activities. Yeah,
I see. So, what role does physiotherapy play in all of this? Is it mainly just to strengthen the muscles?
To mainly educate them,
Yeah. True.
So you can give them thousands of exercises, different exercises, you can just vomit whatever learned past 4 years, but without educate them, you can't do anything. You can't really, you have to educate the as doctor mentioned, the particular player.
Yeah.
Doctor mentioned not to play, but they still go to play.
And
right?
also in terms of posture and things like that, if you keep getting a shoulder injury, but you're standing like this, or you're lifting weights like this, that's where a physiotherapist is
exactly.
to.
Yeah, you have to really educate them. That's very important for them, especially like office workers, computers, their postures.
In this day and age, we're always like this.
Right. So that's where the ergonomics comes into place. We teach them how to sit, how to maintain the proper posture, right? So that's how
to integrate it into a lifestyle.
Yes.
And usually the physiotherapist will not do it aggressively or enhance or very rapid progress of exercises. Once you injured the certain week, then it's that much only you can do. The second week, that much. The third week, that much. So as we become longer, they become more and more exercise that we need to do.
I think that's maybe the reason why people struggle to keep it up is because they're like, if I go for a surgery, my broken bone is fixed.
Correct, yes.
But if I go for physiotherapy, oh my God, it's going to take me like 2-3 months.
But again, after surgery, they have to go for physio again.
True.
Right, yes.
But we have a protocol.
Yes.
Doctor mentioned we have a protocol. We have to follow that. Like first week, you can only do this much. Second week, only this much. Third week, fourth week. You have to follow the protocol. I can't be doing the 5th week program on the first week. I might get worsen your conditions, right? Then you will blaming me. Oh, this is a physio's fault, So we don't want to get into that place, right? So we try to be safe.
But most of the professional athlete is not very, they want it to be a fast recovery.
Yes.
Whatever fast recovery is usually is not immediate. You have to still have a very programmed physiotherapy for recovery.
It just takes time.
Yeah, it takes time.
Okay. So if I was a patient, when would I make the decision to come to a doctor versus when would I make the decision to go to a physiotherapist or a rehabilitation center? What are those? How does the decision look like?
Usually it's more or less a combined things, but usually people will go to the doctor first, just to get the diagnosis, what happened to them. Yeah, what really happens, because I just have one patient. They went here and there, and then when different GPs, talking about GPs, and then finally he went to the hospitals and see us, and then they want to know what exactly happened to them. Then we need to do some diagnosis treatment, which is X-rays, MRI, or even CT scans to diagnose it completely. So when I say this one, okay, you may have this kind of problems, for example, meniscus, and then I don't think I need to do any surgery on you. Yeah, so that means what you do, you have to do some exercises. Then I refer to physiotherapists.
So there's no diagnosis that happens in a rehabilitation center?
It does happen. Like some clients, as doctors mentioned, they go variety of places. They used to come to physio centers first, without taking MRI or any diagnostic using diagnostic machines. We can't really tell accurate diagnosis, right? And that's not ethical as well, right? So we will diagnose physically and all. Then if we feel that, okay, we better find a doctor, better go to a specialist and get the proper diagnosis and come.
Yeah.
If not necessary, we will carry on with our treatments.
Yes.
Yeah.
Okay.
Yeah,
But most of the time, to be safe, we will send to the
doctor first.
Yeah. Usually the one that goes straight to a physiotherapist, they had done something before.
Okay.
I think that physiotherapist will make him good. For example, you just go straight.
Yeah.
So do you think that like wearing like high heels a lot like that also is like bad for your bones? Personal question lah.
All right. How high?
Today not so high. Some days a little higher.
Yeah. So I just tell you one incident, because it's 5 inch. Yeah. So she used to walk. It's normal. Okay. So one day she went for dinner. I'm definitely high heel. So you just want to step down from a step, I think 5 or 6 steps. Suddenly you just misstep. What happened to her? Broke the leg.
Broke her leg.
Yeah. So and after that I treat the fracture, everything here. So after that, now I reduce from 5 to 3.
Still not flat.
Still not flat.
So it doesn't
she can't wear without because once you get used to it, you have to wear.
Yeah. So it doesn't necessarily like wear your bones, but it's more of your risk of falling that's increased.
Yeah. The one that risk for bone is basically, do you know when your high heel, what do you call it, stiletto? Is it?
Yeah, stilettos?
Yeah, stiletto.
Like more than 5 inches.
Yeah, 5 inches. Yeah, and you know how the posture? It's like that.
Like that. Yeah.
More of lordotic.
Yeah, because you to balance. Yeah.
And just wait for a few years.
No,
you got a backache.
Yeah.
You got a backache.
So when I was researching about orthopedics, because I don't know anything about orthopedics, I came across this assessment called the 10-year fracture risk assessment. What is that?
Okay, so I think this one is the fracture risk assessment. Meaning is the risk of your bone to become fractures. Yeah, and usually it will not happen in below 40s.
Okay.
Yeah, unless that. Meaning this one is the one that spontaneous fractures can happen. Like the mention that I mentioned just now, the old lady.
Yes.
Yeah, it is just trivial fall, not really the high velocity, high impact
this
accident.
It
just fell down, and then they just broke. Okay, for my mom also, it just fell down from this height to that, broke. So that means that BMD, the one that you mentioned just now, bone mineral density, we have the result of 3 categories. You see it with color, the green, yellow, and red. The green meaning is you're healthy. The yellow means you are in the borderline. The red, you are at risk.
High risk.
And there we mention about the percentage of fracture for that.
So, is this something people should do often after the age of 40?
After menopause.
After menopause for women and for men?
Yeah, after menopause.
Men also after menopause?
Yeah, menopause is 65 for men.
Okay.
All right. So women
40,
is 20 years earlier.
We gotta go to the doctor more often. So, what can yearly health screenings tell us about our bone health?
Basically, in bone health screening, you do some test, chemical tests. For example, is the calcium level, the phosphate level, and then some of the people, they will do another variety of general screening, yeah, which is may affect the bone, and plus your BMD and X-rays. Yeah, so these are the main bone screening. So the other chemical screening is basically any other diseases that can cause osteoporosis or bone weakness. For example, just now I said is the diabetic. Yeah, so when your diabetic is not in control, let's say 16, 20, definitely is osteoporotic. Yeah, so that means bone screening is quite good, but again, usually it's not for younger age. Usually it's 45 and above to have that bone screening.
Yeah, and it's also just good to know that, so you know that you have to be more cautious.
Correct,
or I guess from those results is when you can decide that, hey, maybe it's time I start going to more frequent physiotherapy.
But from some of the, like that you mentioned just now, some of the commercials, milk with calcium. Actually, we have to be very careful on calcium. You have the certain level of calcium level in our blood. If not, then you may have osteoporosis. If it is too high, it will affect your heart.
We gotta keep it at the good ratio.
So that is the one that usually you need to measure.
Awesome. All right. Those are all the questions I have. Thank you so much, Dr. Ruslan, and thank you so much, Guna. And for those of you watching, this has been Health Matters by Malaysia Healthcare. Bye.